Not viable alternatives to vaccination, and I'd much prefer if he made a full-throated recommendation to parents to get kids vaccinated, especially in the setting of the regions where this virus is now spreading. He's talking about steroids and antibiotics. Those would be used in the setting of a child who's developed pneumonitis, is hospitalized, has respiratory distress, and so you might dose them with antibiotics to prevent secondary infections, and the steroids can reduce some of the inflammation in the lungs. The hope is children don't get into that kind of distress situation because they've been vaccinated. As far as vitamin A is concerned, there's really scant evidence that it's effective in this setting. It's used in the setting of malnourished children where it might provide some benefit. But I think talking about those kinds of therapeutics in this context creates a false impression that there's treatments available for measles when in fact there's not. The only way to prevent measles and prevent the sequelae from measles is to get vaccinated. You know, it's the same way people may consider whether or not they choose to get vaccinated for influenza, for the flu. Some people might make a decision not to get vaccinated because they know therapeutics are available. I certainly wouldn't recommend that, that they do that. I think everyone should get vaccinated for influenza. But some people might make that choice. There is no choice in this setting. There's nothing effective at mitigating the effects of measles once you get it. So the only way to do that is to get vaccinated.
Yeah, the CDC website describes vitamin A as supportive care, but vaccination the best defense.